Are you unknowingly putting yourself at risk for kidney stones? You might be surprised to learn that common everyday habits and dietary choices could be contributing to the formation of these painful stones. In our latest video, we'll uncover 10 surprising causes of kidney stones that you need to know about. From low urine volume due to dehydration to the hidden dangers in certain foods and medications, we'll explore how these factors can affect your kidney health. Plus, we'll share practical tips on how to avoid kidney stones and keep your urinary tract in top shape. Whether you have a family history of kidney stones or simply want to take proactive steps to prevent them, this video is a must-watch. Don't miss out on these essential insights your kidneys will thank you. Click to watch now and take the first step towards a healthier, stone-free life. Number 1. Low volume of urine. Regularly having low urine volume, which is frequently the result of dehydration, is a significant risk factor for kidney stones. Pee is more concentrated and darker when the body is dry because it contains less water. Kidney stones develop because there is not enough moisture in this concentrated urine to dissolve salts and minerals. Dehydration can result from several factors, including working or living in hot conditions, sweating excessively from vigorous exercise, or just not drinking enough water throughout the day. It's critical to consume more fluids, especially water, to combat this. Urine contains salts and minerals that can crystallize and form stones. Water helps to dilute these substances. One of the easiest and most efficient ways to lower the risk of kidney stones is to make sure you're getting enough water. Experts advise consuming 8 to 10 glasses of water a day, or more if you live in a hot area or engage in physically demanding activities. You can successfully avoid kidney stones, a painful and frequently reoccurring problem, by keeping your urine diluted, which will improve the general health of your urinary tract. Number 2. Unhealthy diet. Kidney stones are often caused by an unhealthful diet. Although consuming large levels of calcium can raise the risk, since calcium is essential for healthy bones, you shouldn't completely cut it out of your diet. The issue frequently occurs when the bones are unable to adequately absorb calcium, which may be caused by insufficiencies in vital minerals such as vitamin C and K. Vitamin C is essential for the synthesis of collagen, which affects the bone structure, while vitamin K aids in the activation of osteocalcin, a protein involved in the creation of bones. Inadequate vitamin intake causes calcium to stay in the blood, which increases the risk of kidney stones. Furthermore, a high sodium diet may make this problem worse, since sodium causes the kidneys to excrete more calcium in the urine. Stones can be formed in the urine by the combination of excess calcium and other chemicals. It's critical to maintain dietary balance by consuming moderate amounts of calcium and making sure you get enough vitamins. Kidney stones can be prevented by including fruits, vegetables, whole grains, and limiting salty foods. These actions can assist in maintaining this equilibrium. Kidney stone risk can be considerably reduced, and general health can be enhanced by keeping an eye on eating habits and making appropriate modifications. Number 3. Specific bowel conditions. Kidney stones, especially calcium oxalate stones, can be greatly increased by certain gastrointestinal disorders and surgical procedures. Extremely concentrated urine is the result of conditions such as Crohn's disease, ulcerative colitis, and persistent diarrhea that cause the body to lose a substantial amount of fluid. Eat healthful foods like spinach, kale, and Swiss chard. However, the intestines may absorb more calcium and oxalates from these foods if you have inflammatory bowel disease or have had certain intestinal procedures. Kidney stones are more likely as a result of the increased calcium oxalate content in the urine caused by this excessive absorption. Furthermore, food changes for these illnesses frequently raise the risk of stones unintentionally. For example, dietary changes that impact mineral absorption and increased fluid intake may be necessary to manage chronic diarrhea. As a result, people who have these intestinal disorders must watch how much calcium and sodium they eat. Regular monitoring and individualized dietary guidance from healthcare specialists can help control these risks. For those who have these problems, it's important to keep an eye on urine concentration, hydrate well, and maintain a balanced diet to prevent kidney stones. Number 4. Obesity. Kidney stones have obesity as a major risk factor. Higher excretion of oxalates in the urine is linked to excess body weight and may have a role in the development of stones. A higher risk of kidney stones is also associated with high blood pressure and type 2 diabetes, two conditions that are frequently brought on by obesity. The bigger the body mass index, BMI, the higher the danger, especially if the person is dehydrated. Extra fat can interfere with kidney function and change the mineral balance, creating a setting that is favorable for the development of stones. To reduce this risk, it is crucial to maintain a healthy weight through a balanced diet and consistent exercise. A well-balanced diet that is low in processed foods and added sugars and high in fruits, vegetables, and whole grains can help control weight and lower the incidence of kidney stones. Frequent exercise not only helps people lose weight, but also enhances general health and lowers their risk of developing illnesses that can lead to kidney stones. Thus, preventing kidney stones and advancing general health and well-being require tackling obesity. Number 5. Certain medical conditions. Kidney stones can be more likely to occur in people with specific medical conditions. For example, an excess of calcium in the blood and urine might result from an aberrant expansion of the parathyroid glands, which raises the risk of kidney stones. Hyperparathyroidism is a disorder that causes excessive excretion of calcium due to disruptions in calcium homeostasis. The condition known as distal renal tubular acidosis, which is defined by an accumulation of acid in the body, also raises the risk of calcium phosphate stones. The risk is also markedly increased by rare hereditary illnesses such as primary hyperoxaluria and cystinuria. Primary hyperoxaluria causes excessive oxalate formation by the liver, which leads to oxalate stones, whereas cystinuria causes high levels of cysteine in the urine, which causes cysteine stones. Often, particular dietary modifications and intensive medical supervision are necessary for the management of these disorders. It's crucial to follow recommended therapies, stay hydrated, and regularly monitor the composition of your urine. To avoid kidney stones and preserve kidney health, it is essential to comprehend and treat these underlying disorders. Number 6. Certain medications. Kidney stones can become more likely as a result of some drugs and nutritional supplements. For instance, many diuretics and antacids with calcium as an ingredient raise the calcium content of the urine, which encourages the development of calcium stones. The body can convert large amounts of vitamin C supplements into oxalates, which can result in oxalate stones. Furthermore, drugs used to treat specific illnesses, such as gout, can raise uric acid levels, which can lead to uric acid stones. It's critical to let medical professionals know about all prescription drugs and dietary supplements consumed so they can evaluate any possible risks and make any required changes or substitutions. It's crucial to heed medical advice because stopping medicines suddenly without first seeing a doctor can have negative effects. Maintain a balanced diet, track urine output and composition, and remain hydrated to reduce hazards. Kidney stones can be avoided while guaranteeing that other medical disorders are effectively treated by being proactive about drug management and seeking advice from healthcare professionals. Number 7. Family history. An individual's risk of acquiring kidney stones might be considerably raised by a family history of the condition. The development of stones is mostly influenced by genetic factors because specific genes affect how the kidneys process minerals like oxalate and calcium. Higher amounts of these compounds in the urine due to genetic predispositions can promote the formation of stones. Additionally, common food and lifestyle choices among family members may increase the risk even more. For example, all members of the family may be at higher risk if the family diet is deficient in key nutrients or excessive in sodium. Being aware of this inherited risk can inspire preventative action to avoid stones. People who have a family history of kidney stones should talk to their healthcare providers about their risk. They could suggest particular lifestyle modifications or monitoring techniques. This risk can be managed with a balanced diet, increased hydration consumption, and routine checkups with the doctor. Those who have a family history of kidney stones can effectively avoid kidney stones and preserve renal health by addressing genetic and environmental variables. Number 8. Not drinking enough water. Kidney stones can be frequently and easily prevented by not drinking enough water. Dehydration produces urine that is extremely concentrated, which is perfect for the development of stones. Concentrated urine can cause salts and minerals to crystallize and aggregate, resulting in stones. Urine that is dark in color is an obvious indication that you should drink more water. By just drinking enough water, you can dilute these salts and minerals and lower your chance of developing stones. It is advised to consume 8 to 10 glasses of water daily, or more if you reside in a hot area or are physically active. The greatest liquid to stay hydrated is water, but other liquids, such as herbal teas and citrus beverages, can also be helpful since they contain citrate, which inhibits the formation of stones. A practical technique to make sure you're hydrated enough is to watch the color of your urine. Clear or light yellow pee suggests you're getting enough fluids. One easy way to prevent kidney stones and support overall kidney function is to make a conscious effort to keep hydrated. Number 9. Excessive intake of oxalate-rich foods. Kidney stones can occur as a result of eating too many meals high in oxalate. Oxalates are found in foods including spinach, beets, almonds, and chocolate. These oxalates can combine with calcium in the urine to produce kidney stones called calcium oxalate stones, which are the most frequent kind. Though rich in nutrients, overindulging in certain meals can raise the risk of kidney stones, particularly in individuals who are at risk. It's crucial to balance meals high in oxalate with enough calcium in the diet. In the intestines, calcium binds to oxalate, blocking its absorption into the circulation and subsequent kidney excretion. As a result, less oxalate is available to form stones. Moreover, maintaining this equilibrium during meals might be facilitated by combining foods high in calcium and oxalate. It may be wise for those who are at high risk to limit their consumption of foods high in oxalate and seek advice from a healthcare professional or nutritionist for individualized dietary recommendations. While maintaining a varied and nutrient-rich diet, kidney stones can be avoided by appropriately controlling oxalate intake. Number 10. High sodium diet. One of the main risk factors for kidney stones is a diet high in sodium. The kidneys release more calcium into the urine when an excessive amount of salt is consumed. This calcium might subsequently mix with phosphate or oxalate to create stones. Fast food, processed foods, and salty snacks are some of the main causes of a diet high in sodium. Cutting back on sodium is essential to avoid kidney stones. Try to limit your daily sodium intake to 2,300 milligrams or fewer if kidney stones are a possibility for you. Reducing sodium intake can be achieved by reading food labels, selecting fresh foods over processed ones, and flavoring food with herbs and spices rather than salt. A balanced diet high in fruits, vegetables, and whole grains can also help to lower the risk of kidney stones and promote general kidney health. One of the most important steps in preventing kidney stones and promoting long-term kidney health is monitoring and controlling sodium consumption. Now that we've covered the surprising causes of kidney stones, let's look at some of the most effective ways to avoid them. To keep your urine diluted and flowing easily throughout the day, drink a lot of water and other liquids. Your body is fairly adept at telling you when it needs water, so pay attention to those cues and act quickly if you feel thirsty. A balanced diet rich in fruits, vegetables, and whole grains should be your main priority. Try to stay away from meals high in oxalates and calcium, as well as large levels of salt if you already have kidney stone symptoms or risk factors. Consuming large amounts of these drinks has been associated with an increased risk of renal inflammation, kidney stones, and various other health problems. Steer clear of them as much as you can. Exercise regularly can help you maintain a healthy weight, which is crucial because obesity increases the risk of kidney stones. In addition to lowering the chance of kidney stones, exercise can also help lower your risk of diabetes and high blood pressure. Due to their diuretic properties, alcohol and caffeine can both dehydrate the body. This may make kidney stones more likely to occur. To ensure that your body is well hydrated, try consuming fewer of these beverages. Remember, staying hydrated, maintaining a balanced diet, managing your weight, and being mindful of your medications and family history are crucial steps in preventing kidney stones. Implementing these lifestyle changes can significantly reduce your risk and promote overall well-being. By adopting these lifestyle changes, you can lower your chance of getting kidney stones and preserve general kidney health, And don't forget to subscribe to our channel for more health tips and advice. Hit the notification bell so you never miss an update. Stay healthy, and we'll see you in the next video.